Hi, I'm Debbie Ryczinski. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at BPD, welcome and thank you for joining us for today's webinar. We are looking forward to a timely discussion on patient acquisition marketing, solving for the most common challenges. Countless tools and strategies are available for building successful patient acquisition programs, yet healthcare marketers repeatedly encounter the same challenges: gaining access to the data they need, balancing conflicting asks from service line leaders, and proving ROI. In today's webinar, you'll hear practical tips and strategies for navigating the everyday challenges of building a successful, provable patient acquisition program. One note before we begin: attendees are in listen-only mode, but if you would like to ask a question, you can. Just enter it into the question answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. With that, I'll turn the program over to Trish Brawner, Executive Vice President of Client Services at BPD. Trish will be leading today's discussion. Trish?
All right. Thank you so much, Debbie, for that introduction. As Debbie said, my name is Trish Brawner, Executive Vice President of Client Services at BPD. Welcome to our webinar today. We are so happy to have you all. As Debbie teed up so nicely, we are going to be talking about patient acquisition marketing. We know that this is a critical part of all of our jobs, but like much of what we do in healthcare, it certainly comes with its challenges and complexities. So we're going to talk through a lot of those roadblocks today and hopefully give you all some really actionable steps that you can take coming out of this webinar that you can start implementing in your organization. So just to lay some quick groundwork, you'll also hear us refer to this as precision marketing. And what we mean by that is when we're using proprietary data to identify a list of individual consumers who have a given propensity for, in this case, for some sort of clinical or medical need. And then we go through an audience segmentation process and then target them and engage them with media. So that is really where our focus is going to be today. But before we dive into the details, I would like for my colleagues and partners here to introduce themselves. So I'm going to pass it over to Erica.
Erica Tyner, Marketing Account Manager with Adventist Health.
Good afternoon, everybody. Josh Donaghue. I am the Vice President of Tradigital Media at BPD.
And hi, everyone. Ann DiNapoli, Blog, Managing Director of Data Solutions and Analytics at BPD.
All right. Thank you, everyone. So as we dive in here, we're going to start off with Erica just giving us a quick snapshot of Adventist Health.
Yeah, so Adventist Health is a nonprofit, faith-based health system that operates at over 400 sites of care across the West Coast and Hawaii. We're continuing to expand our footprint in those areas, both in rural and urban communities. And prior to this patient acquisition marketing, we really did do a lot of awareness and service line marketing, but we had limited ROI and volume tracking. So we wanted to shift the mindset of the company to view marketing as more of a strategic partner and a growth engine for the organization. To do this, we needed the program to leverage three key elements. First, driving patient volume to the services that we identified in the markets we had selected. And second, we needed to be able to attribute that volume to our marketing efforts. Third, we needed to leverage consumer data that we had never before had access to be able to segment audiences and message them in a precise and meaningful way that would encourage them to take action. So I'll pass it over to Ann to go over the 7 roadblocks that we experience with this kind of marketing.
Thanks, Erica. So all those key elements, they sound so easy, right? Driving patient volumes to the right individuals and then being able to measure it all together. We found it's certainly not a cakewalk. In fact, it's full of lots of different obstacles. So today's webinar, we're going to focus on unpacking 7 of the roadblocks that we find that you might experience along this journey, but we have come with solutions. So you just have to know that just because it's a roadblock doesn't mean you need to take a detour. So with that, we're going to kick off with roadblock number 1. So roadblock number 1 is all about what service area to prioritize. Everyone believes that their area should be prioritized, yet you have limited resources, time, and effort. So how do you select which area to drive patient volumes to? So the solution for that challenge we have found is really trying to create a strategy to level the playing field. It's all about using data for your data-driven marketing. We have created and have really worked alongside Erica and many of our clients on what we lovingly call SAM. So SAM is a strategic allocation model. What it does is it uses a data-driven approach to help you land on the right decision of which service lines to prioritize with your patient acquisition efforts. Now, oftentimes, strategic allocation models require a lot of internal meetings and stakeholders and discovery calls that you have to do to really get to the right answers of some of these objective and subjective measures. But once you do all the due diligence to gather all the information you need, so things like what is service line volume capacity? How many physicians and providers are we needing to support here? What is the total growth potential of this service line volume in my zip codes and my markets over the next 5 years? Those are the types of things that you need to take into consideration. And again, once you gather those data points, it's all about creating a model. So in this instance, it could be a very simple weighted model, meaning that you simply create a scoring system, 1 through 5 as an example of that, of where you place the weights, and then you prioritize what might be most important for you. So an example of that might be, you have found that contribution margin is really the key driver to defining marketing success. You might weight that in your model at a 50% score against your scoring system. So Erica's going to tell us a little bit how Adventist Health went down this journey of prioritizing their service lines.
We actually leverage all the attributes that Anne just mentioned. We partnered with system and market leaders in a variety of different roles to create our unique scorecards. And there were, of course, iterations, and these evolved over time, but profitability needed to be high to prove the success of these campaigns. Access also needed to be there. So all of those things varied in weights, and they helped us make our selections for our first year of campaigns. And because of the size of our organization, there were a lot of service lines and markets to consider, especially that first year when we were learning how and where this really works. So this model allowed us to make strategic decisions and bring people in early on because they were a part of the decisions and the development of this program.
Thanks, Erica. Okay, so we just covered the roadblock of how to prioritize service lines. Roadblock number 2. Accessing the data requires so many people and resources, it feels like an uphill battle. Now, we know so many folks have experienced this before, but let's start first by talking about what type of data we are needing to access for this. So at the end of the day, these types of marketing programs, you need to be able to prove value for who came in for an encounter into your health system. So for this exercise, it's really truly unlocking and being able to capture the right patient data so that you can map it back to your marketing activities. So how do you do that? We have the 3 top challenges and the 3 top strategies that we're going to go over today to really help you be able to achieve the access to the patient data to make these programs work. So Erica's going to cover number 1, and I'll do number 2 and 3.
So looking at that first challenge of limited internal resources, bandwidth, and an extra need for cost. So where we started was with internal campaigning, saying this is what we're trying to do, and this is why we need internal support teams like data and analytics and external support teams like partners and BPD in order to run this program successfully, helping our teams understand why this was important to the organization and what we needed to be successful is what ultimately allowed us to gain the resources, the support, and the investment that we needed. And today, we work with these support teams as well as have a small team within our marketing department dedicated to this program.
Okay, so challenge number 2 for accessing the data is all about data privacy and regulatory concerns. So we know that this is a very quickly and rapidly evolving change and pace within our industry right now. Now, what we're not saying is that you have to be the full expert here, but one of the ways to unlock the ability to be able to access the data with all these folks who are concerned about giving it to marketing folks is really all about education and alignment. Now, you really need to be up on the latest regulatory and bulletins that are released in this space, but then how you are applying it to your strategy is what you should really focus on. So be the expert when you're bringing IT teams and legal teams in, and as far as how you want to use the data, what you are trying to achieve, what you are tracking, how the models against your data will be built, and what folks you will be reaching. Being able to answer those really critical questions with these types of stakeholders will make your case go a long way. So once you achieve that challenge of being able to test, right, the next thing is all about data tools and infrastructure setup. Now, we know these tools and this type of data can sometimes cost a lot of money on how to manage it. Your time and resources with your budgets may be really limited, and that being such a big challenge. So how to overcome that is you don't have to boil the ocean to get started, right? I think sort of what we recommend is looking at small use cases, the ability to maybe start with one small campaign and show some value over time. And that can really create a groundswell within your system where folks will want to rally around you to be able to make more success out of this type of strategy. So testing to show impact is a great way to overcome that challenge. Okay, so we've covered service line prioritization and how to get access to the data. So you have your access. Now, where do you begin with audience segmentation? Roadblock number 3. How do we know what audience segmentation is right for us? So this is a framework that our teams have developed to really go to market on how we create the right types of audiences for these types of marketing campaigns. Now, typically you would have your health system brand work and your service line awareness aligned to your broad demo targets within your PSAs and SSAs and your zip codes. The segmentation work that you may be doing applies to broader service line awareness, but what we're really talking about to drive impact for patient acquisition is microsegmentations. Microsegmentations really take an art and a science to craft the right messages to the right people. And it can be really overwhelming. There's a plethora of different attributes and data sets that you can use and techniques to create these types of audiences. Things you need to consider might be how many audiences to create. What is the least common denominator of what dignifies a microsegment, right? So really this is taking a big step back, looking at all your data sets across things like research and insights, any third-party attributes or secondary research that you might have access to, looking at the licensed data and models that you might be building healthcare propensities against, and then looking at how you develop those microsegments. Things like clinical disease data and then new technologies like AI are really speeding up the ability to do machine learning on these types of models. And how you just take a step back. There is no right answer here. You just have to really find what's going to work best for your strategy. It's all about making sure that you have the right types of audiences so that you can deploy the right media mix and the right creative messaging against those right audiences. So Erica's going to tell us a little bit how Adventist Health did that.
Yeah, so this part was actually really exciting for us. We hadn't done this before, and we ended up finding that audience segmentation would look different market to market and between service lines. So how we would build a cardiology audience in one market was different than how we would do so in another geography. So we were able to work with the uniqueness of our markets, which made it feel even more precise and customized. And now Trish will share one of our campaign examples.
Yeah, thank you, Erica. So as we're starting to talk about audience segmentation, we thought it would be really helpful to share one of our case studies of a campaign that we've been running in partnership with Erica and her team. So this particular campaign we're going to talk about is all about driving orthopedic volumes. I'm sure many of us on the webinar right now have heard that from our executives. Hey, we need orthopedic volumes. We need ortho. How do we do it? So in this case, in one of the Adventist Health markets, orthopedic was a service line that was a priority. And we went through that whole SAM model to identify that this was one area that we really wanted to run one of these campaigns. So as we started to dig into the data, it really led us to the direction of having two distinct audiences. And we're going to talk through some of the specifics about each of those audiences. So the first one we call our stay active audience. So these folks were likely to need orthopedic care, but really for the purpose of staying active and supporting different activities with their families. Geographically, we were targeting our PSA and SSA. And in looking at the data, we also identified an opportunity to expand the radius around our typical market areas because we really felt, given some of the expertise that we had, that we could pull from a broader area. From an age perspective, these folks tended to be in that 55 to 64 age range. Pretty healthy group overall, likely to have really limited comorbidities, be more active, and a bit more affluent. And then on the other side of the slide, you'll see our regain mobility audience. So this group also likely to need orthopedic care, but kind of nuanced and for different purposes than our first audience. So these folks we found have been experiencing ongoing pain and really mobility issues, probably for some amount of time. So for them, geographic targeting was the same. However, we saw that they tended to be a bit older, so more in that 65 to 74-year age range. And these folks weren't kind of the same picture of health that our first folks were. They were likely to suffer from more comorbidities and probably less affluent than our first group. So other things that we looked at in the data, we were looking at what are their values, what is their family makeup, general health attitudes and behaviors. And so all of this together really pointed us in the direction of these two audiences. So now that we've gone through how do we invest our budgets and figure out where we're going to prioritize our dollars, how are we going to get access to the data, how do we tackle audience segmentation, the next roadblock that we wanted to tackle was how do we develop tailored messaging across audiences and creative assets? Because when we have all of these different audiences and all of these needs, it can feel really complex and really daunting. So the first part, before we even got to getting into the creative development, we really had to tackle kind of a shift in mindset. So when we do these precision marketing campaigns, the messaging tends to be much more specific, much more direct and granular, because these folks are already sort of in that world of, in this case, needing orthopedic care. So the other thing that we were seeing was that the messaging tended to be a bit higher level of a sort of that standard reading level that we would typically create. So Erica, do you want to speak to this a little bit and what you all experienced on your end?
Yeah, so this was uncomfortable even for our own marketing team. We talk a lot about getting buy-in from internal stakeholders, but in this case, it was actually changing the mindset of our own team when seeing this direct and symptom-based marketing. And what might have been the hardest to wrap our mind around was using that higher level vocabulary, that medical terminology with some of these audience segments. We wouldn't typically do this. So we had a lot of dialogue with BPD about why was this style of messaging important? What data supported this approach? And how would this work in our communities? But ultimately, we did see the potential benefits. And because our audiences were familiar with their condition, this messaging really resonated with them. And these strategies have proven to be successful in these audiences.
All right, so we're going to share with you a couple of examples of the type of messaging that we've tested, and then some actual creative examples as well. So different messaging angles we've explored and tested include things like risk factors. So again, in this case, we're talking about needs for orthopedic services, treatment options. Sometimes we will take a sort of myth versus fact approach, and you'll see a few examples of that here in a minute. Overall, we're just really working to relate to the audience's challenge, the audience challenges, and provide solutions. We know that these folks are experiencing some things, and we've got some solutions that can help. So let's talk about a couple of creative examples here. So we're going to start with that first audience, that stay active audience, who tended to be a little bit younger and may have some orthopedic needs, but really for the purposes of wanting to continue to live that active lifestyle. So we've got some display creative over on the left side of the screen that's talking about hip replacements and some benefits to when we're able to minimize that muscle damage, improve recovery time. So really focusing on those needs that are most important to this audience. You'll also see the call to action here is to take a hip quiz. So you'll see that call to action throughout a lot of our creative samples where we were driving these folks to a unique landing page that then included a health risk assessment that was a quick, easy thing for them to take to help assess whether they might be a candidate for a procedure like this. And then ultimately we would connect them with someone from Adventist Health. So on the right side of the screen here, we've got a couple of social examples. So on the one in the middle here is talking about knee replacements. You can see we're doing that myth versus fact approach, really helping people, this audience, understand that, hey, knee replacements aren't just for those who have arthritis. We know these folks are active. They might be in need of something like this as well. On the right side, we're talking about hip pain and again, really focused on that recovery time that people might be fearful of, again, because they just want to stay active and keep living their lives. All right, so we are going to now move to the next audience. So moving on to our regain mobility audience. So this group again was a little bit older. They've been experiencing pain, some loss of mobility. So we really wanted to tailor the imagery and the messaging to those attributes that we knew about these folks. So on the left-hand side here, you can see we've got some display creative where we're talking about some pain that they may be experiencing, and then we're driving them again to a hip assessment or health risk assessment there. And then on the right side, we've got a couple of different social examples where we are really kind of playing off of that age range. So we're talking about, bell bottoms and 8-track players. So kind of knowing the age range that these folks are in. And then again, driving them to that hip quiz and using imagery that aligns with what we know about these folks. Now we just have a few more examples that we want to share here just to kind of illustrate how we take this data and all of these insights that we know about these folks and really tailor the creative, not only to the audience, but also to the media channel. So on the left side here, we've got two videos we're going to play. On the left side here is a video that we used, again, for our Stay Active audience. We use this in the programmatic video space. And the first thing I want to call out here is what you see on the screen. It says kinematically aligned total knee replacement. So that's a mouthful, and I think a great example that Erica spoke to where we were using sort of higher level vocabulary, but we were comfortable with it given what we knew about this audience. So I'm just going to click play here and share it with you guys. So a few things I want to call out here. So you'll notice that our call to action here was learn more. So for this particular campaign, we were using programmatic video as more of an awareness driver and an opportunity to kind of tell more of that story. So we had a different call to action, but still driving the folks to that unique landing page. And then as you see, we're using messaging and imagery that aligns with that Stay Active audience. On the right side here, we've got another video we'll play in a second here. Now, this was used in the OTT space. So this would be something that people would think on Hulu or Roku, but they're going to see it on their TV. So the call to action here is still learn more, but instead of a click, since it's something that they're going to see on their TV, we've got a QR code that they can scan that will then take them to the landing page. So let me click here. So just two examples there, how we've got video creative really tailored to the audience as well as the media channel. All right, now we are going to move on to roadblock number 5. I'm going to pass it over to Josh.
Thanks, Trish. So I'm going to walk you guys through roadblock number 5, which is I'm not sure how to build my media plan or how to incorporate it into my current activations in the markets that we're in. So where do we get started? First, we truly have to understand our aerial support. And what I mean by aerial support is, what is that media support that currently exists in market? What's that brand support that's driving our story of our why and our points of differentiation? Do we have service line differentiation going on in the marketplace from a media activation perspective? Do we honestly believe that consumers understand who we are and why they should choose us, whether that's from a brand perspective or for the individual service line that you would want to be promoting for precision marketing? And remember, precision marketing, as Trish and Anna touched on, is designed for that one-to-one engagement to drive volumes. But if that brand support and service line differentiation doesn't currently exist in your market, you really want to customize your precision activation strategy to account for just that. Because we all know that you have to fill the top of the funnel with our stories about our brand anthem and stories of differentiations to ultimately drive that consumer from consideration to conversion, right? And we all know that every one of us on this call has finite marketing funds, right? So making sure that all of our precision efforts are in symmetry with what else is going on in the market. So we're not oversaturating potential consumer bases, and we're not being duplicative of what it is that's going on in the marketplaces as well. So we're going to walk you guys through a few examples of how our channel mix may look different for different levels of aerial support. So now that we've established what that aerial support looks like, how do we ultimately implement what's going to be the ideal activation strategy and channel mix for our individual markets? And the beautiful thing about precision marketing is that we know exactly who we're serving the ads to. And we understand, or we need to understand, what are those channels that we can guarantee that one-to-one engagement with those addressable media options, where we can ensure if Trish is on the list, only Trish is getting that ad. That's going to be extremely important to the success of our campaigns. And the other thing that I want to keep in mind for everybody is that different channels can ultimately serve different purposes. And Trish sort of alluded to this on the last few slides. So as you do your analysis of your aerial support, maybe you do want to use programmatic video, but you understand that, you know what, maybe we do need a little additional brand support, the stories of differentiation. So we're going to serve those programmatic video ads, but we really want people to watch those ads through completion. We want to continue to educate. Or you do that same analysis and you understand, wow, I have great brand support in market. People truly understand what it is that I'm offering and why they should choose us. Let's use programmatic video, but this time let's have that hard CTA to make sure that we're driving that engagement and ultimately that conversion. And the platform-specific creative, guys, is going to be extremely important. We know so much about the individuals that we're going to be serving the ads to. Let's take advantage of that. Let's have unique stories. Let's have unique aesthetics, and understanding that today's consumer mindset is different, right? Think about yourself as the consumer. Your mindset at 6 a.m, maybe when you're laying in bed, or maybe you're one of those go-to, let's get on the Peloton and you're scrolling through your phone. That mentality is different at 6 a.m. than it is at 10 p.m. at night. Maybe when you're laying in bed again and you're watching Hulu and you're scrolling through your phone there. Different ads, different purposes, different messaging strategy. This is going to be extremely important that our messages resonate and we drive that genuine interaction. So what do those ideal sample media mixes look like? And we sort of bucket these into 3 different categories, starting with video distribution. So the CTVs, the programmatic videos of the world, the YouTube. We can guarantee that one-to-one engagement in each one of them. And again, each one of those areas and different channels can serve different purposes, and we can use different messages to do different things. As you move down the list, right, so we drive the consumer down the funnel, programmatic display is going to be that high reach, low CPM, and bombard our consumers with our messages to ultimately convince them to take the action that we want them to take. We really do encourage rich media here. We have the ability to take advantage of all the technological advances. How do we continue to excite with the stories that we're telling in a fundamentally and historically mundane channel? And then lastly, we all know the importance of social media. So how do we take advantage of when consumers are on LinkedIn or TikTok or all the different meta family of placements with Facebook and Instagram? And lastly, the role of paid search. So although we can't utilize paid search in that one-to-one manner with the list, we understand how consumers work, right? We understand the mentality. Again, be a consumer that's being served that orthopedic ad. You're seeing it on programmatic video. Maybe you're seeing it on CTV or display. The likelihood of you stopping what you're doing, clicking on that ad, delivering us to our websites, and converting is not as high as it is that when you've done that work, we've seeded the market, we've informed them of our story and our points of why, and they go to paid search. We show our points of differentiation here. We have to capitalize when those individuals are showing that intent. And then lastly, we do have the good old direct mail. There are certain audiences that this is a great way for us to communicate. We can do it in a one-to-one manner, very easy to track. So now I'm going to pass it over to Erica, who's going to walk you through how we need to educate our organizations about the visibility of these campaigns in your market.
So what happens when these campaigns feel invisible to our stakeholders? This is something that was very different for some of our market stakeholders. This is not driving to work every day and seeing your hospital billboard. And this can feel unsettling at first, because if you don't see it, you might not believe it, right? These campaigns are entirely digital and intentional. So our stakeholders could be in the target area, they could be in the age range and the income range. But if their digital footprint doesn't indicate that they need our cardiology services, they're just not going to see our cardiology campaign. And even for those that we had early buy-in from, when it came down to actually experiencing it, it was hard for some of them. And it goes back to how important early education is. We're not trying to cast this wide net anymore. We're wanting to target those that we know need our care. And it took reminding throughout the campaigns that just because you're not seeing it, it doesn't mean it's not working or that it's not there. And once the campaigns were up and running, we could start sharing results. So for many of those that were still on the fence, we found those results were the proof points that they needed to feel more comfortable with the process. But it really did take reminding to help everybody understand and support this. We've talked about the obstacles that we needed to overcome and the methodology needed to stand up a successful campaign. But once these campaigns are launched, how do we ensure that we have the infrastructure in place to capture these leads and route them appropriately? So in the next slide, you'll see the flow charts that we've developed for each campaign. And the goal of these charts is to show operational fidelity before the campaigns launch. We want to understand the comprehensive consumer journey, because even with the same service line, this can look different in each market. This also helps us identify gaps so we can work with our local teams and make improvements to the journey, because at the end of the day, what we all want is for our patients to have the best possible experience. So these charts start from the beginning. We want to know every step they take, starting with seeing our digital ads, engaging with the campaign, being contacted by a lead manager. And if the lead becomes a patient, what steps do they ideally take from their consult, labs, surgery, follow-up care? We want to know every single touch point. This has also helped us with tracking ROI. So we know what to attribute to each campaign. So even if the patient hasn't made it to surgery yet, we can see that they've had a consult or that they've had imaging, and we get this really clear picture of where they are in the funnel. This tool has also proven to be important for accountability, and that's accountability with our team, with our lead managers. It just keeps us all on the same page. Moving to the next slide, we'll share more about our approach to conversions. As I mentioned, we have a small team that works closely with these campaigns. And at minimum, we're meeting with our lead managers on a weekly basis. And we use this time together to talk through obstacles that they might be facing, trends they might be seeing in leads, or changes to the service line that could impact the campaign. We're also monitoring response times. When we're driving people to one of our service lines, it's so important that they hear back from us in a timely manner. Not only does a lack of response or a late response offer a negative experience, it really does increase the likelihood that they disengage and go elsewhere for care. So this weekly engagement has been really important. In addition to that, we're monitoring call tracking, lead forms, health risk assessments, and webinar views on a regular basis. And this is all done in partnership with BPD to make sure that things are performing the way we would want them to. Next, we'll talk about a skeptical C-suite. I'm sure we've all been there before, especially when bringing something new to the table. A big part of this is understanding what's important to our C-suite and how to speak their language. We level set really early on that we would evaluate success on contribution margin, EBITDA, and patients acquired. This could look different for your organization. This is just how we chose to measure it. All of these things take time though, right? So we needed to make sure we were sharing meaningful data at certain checkpoints along the way. And that included media metrics, valuable stories, and data around the leads that we did see coming in. And as the campaigns ran, these things evolved. A stakeholder might say, well, it's great that we're on track to meeting contribution margin goals, but tell me more about your new patients acquired. And what's the contribution margin for just those new patients? And while this takes time and effort to provide additional data, staying dynamic and providing a few individualized data points for leaders based on what they consider valuable helped us hold their engagement and build trust. Something else that we were challenged with was answering the question, how do we know that these patients wouldn't have come in anyways? We worked really closely with BPD to answer this question with data. One of the ways we did this is through our control group. Being able to say that the patient acquisition rate from this campaign is higher than that of the control group has been a really helpful tool in these conversations. Overall, we've tried to stay dynamic. We've listened to the feedback and what they consider valuable, and we shared additional data points to meet the ask. We did this while still maintaining the integrity of the primary and secondary KPIs that we all agreed upon prior to the launch of these campaigns. It really has been important for us to stay focused on what we all agreed success would look like. I'll pass it to Trish to go over key takeaways from today.
All right, so we just went through 7 roadblocks that we typically face as we're diving into patient acquisition marketing, and we wanted to just recap that and give you all those key takeaways from each of those roadblocks. So first one here is all about prioritizing your marketing investments. So we know that we often hear sometimes it's the squeaky wheel, the squeakiest wheel that's sort of like, I need volumes over here, I need volumes over here. But we talked through a more data-driven approach to help prioritize those investments. Data access. So when accessing the data, it's critical to make sure we're able to line up the investments that are needed, educate the organization along the way, and then prove the value. As Anne talked about, we don't want to have to boil the ocean right away, but create those small tests and small wins that you can be sharing throughout the campaign. Audience segmentation. So really embrace the data, leverage the technology to understand those consumer attributes, and then eventually create those micro segments. And then the next one, data is your friend. So as you're developing messaging and the creative assets, really use the data and those insights and sort of all of those rich nuggets that you have about your audience to create that very tailored messaging and tailored creative assets. Next roadblock was all about media. How do we tackle media activation from a different perspective when we're doing these precision marketing campaigns? So Josh walked us through several different considerations to keep in mind and how we sort of have a different mindset when we're putting together those strategic media plans. And then with all of that, it's more than just the data, the media, and the creative. We also have to make sure that we've got the infrastructure in place to capture and convert those leads. So it's critical to understand what your patient journey is and exactly all of those steps that they go through to become a patient. Make sure that we work through any potential roadblocks in that journey so that we're driving these patients to a service line and we're making it easy for those patients to actually get the services that they need. And finally, building the ROI model. So we have had our share, along with Erica, of those C-suite folks who are skeptical. So making sure that we're really looping them in from the beginning, aligning with them on what the most important KPIs are, and using the control groups as well as that closed loop attribution to make sure that we can prove the effect and the impact that these campaigns are having. So with that, we would love to open it up to questions. I'm going to pass it over to Debbie.
Thank you, Trish, and thanks to all of you for that terrific presentation. So we do have a number of questions from attendees already. And as a reminder, if you have a question that you haven't asked yet, just enter it into the Q&A pane and we'll do our best to get a response to you. So the first question is, can you address HIPAA compliance within digital targeting? a very important topic. So.
Yes. Anne, would you like to tackle this one?
Yes, absolutely. Yes. So, we all know that even last week is news that is coming out for what is considered HIPAA compliant in our digital environment. So there's a lot of different strategies that we deploy. The biggest thing is just ensuring that all the marketing strategies that you go to market with are really vetted through your legal team for what they are understanding the current interpretation of the laws are within your state as well. So that is all really critically important. Some of the strategies that we deploy are really truly just not utilizing any PHI in our audience lists. Everything is modeled against attributes that are available for in like a consumer database set as an example. So, it's really important to ensure that you're staying really tried and true to the efficacy of what your legal counsel is doing as far as the whole can of worms of things like pixels as an example for that. I think again, that is changing and there's a lot of different tools out there that our teams are also utilizing to ensure that there are privacy safe and compliance across all digital marketing activity.
Thank you, Anne. Another question that we're getting here is, can you share more about the lead manager function? Is that a contact center within marketing to support that, or what else can you tell us about that function?
Yeah, great question. Erica, do you want to take that one?
Yeah, so for us, we found that this worked best when the lead manager had some kind of medical experience. And so like an MA, right? That's sitting in the clinic, that's in the office. They know the doctors, they know the patient journey. They can answer questions real time. However, that doesn't always happen. So we have had situations where it's a call center. Our call center doesn't sit within marketing, but they're accustomed to answering these calls. They already work really closely with the service line. So it really does need to be somebody who's integrated and has knowledge of the medical side of this.
Okay, thank you, Erica. A couple people are asking about the methodology for the control group. Can you share the methodology for creating the group and tracking the outcomes? And I guess also a little bit more about what you mean by a control group.
Yeah. Anne, do you want to speak to that one?
Yeah, absolutely. So control groups are a great tool that we have in our toolkit for measuring success of marketing campaigns. What control groups really truly mean are taking a subset of the audiences and the micro segments that you deploy as part of your strategy and simply holding them out from marketing exposure. What you would do for that is really define based on your audience population size, what would be statistically significant in your audience size to hold out. Sometimes this ranges from 1% of your audience all the way up to 10% potentially. And what you would do is hold those groups out and you would not put them on the lists of where you deploy in those addressable media channels that Josh talked about. So we're really truly matching audience lists to channels in this instance and just not exposing them. In addition to that, you might also say you want to do a control group of your total market to make sure that you have the right even types of audiences. So again, if you have access to a full public consumer database, this is available to you to test out as well.
Okay, and I guess sort of similar to control groups, there's a question about how and when is A/B testing appropriate?
Yeah, I'm going to jump in here too, Tricia.
Oh,
So
so
A/B
sorry.
no, don't be. This is great. A/B testing is, I think we do a lot of different types of A/B tests. You can do A/B tests where you're really truly saying this message goes to this subset of your audience and this message does not. What's really important about A/B testing, and there are a lot of native functions within the media channels when you're thinking about like activating the media. Things like Meta has this built into their tool. If you're activating programmatically through a third-party demand-side platform, for example, these tools also typically exist. But the whole goal here is that you want to ensure that your message does not get exposed to the remaining audience so that you can really compare apples to apples what you're testing. So things that you could A/B test are headlines and visuals and videos and all different types of creative assets. But we also do A/B testing at the channel level. Is this channel even the right channel mix? So there's a lot of different ways that you can craft A/B audiences. It's again more of those like art against the science of what you're trying to answer questions against.
Okay, and we also have a question on service lines are legacy-based business divisions. Any thoughts on how you think about business divisions being translated to the overall consumer experience? Consumers and patients caring about their total healthcare journey versus a specific service line? Kind of thoughts on that?
I'm wondering if Erica, if you want to jump in on this. So I think what I think I'm understanding from this question is we have these service line leaders throughout the organization, and how do their needs sort of ladder up to the overarching kind of needs of the organization, and how do we sort of navigate between all of the dynamics there?
Yeah, so I guess with this is when we're looking at a service line need, the root of this is like, what is the need of the organization? Is that volume? Is that contribution margin? And how can that service line tie into that? And so that's where it comes back to. And I think another part of this question that maybe I heard correctly was if there's a legacy there and people choosing a service line as opposed to like Adventist Health or a system. And I think with that, we have found, and I think a lot of other health systems have found that there's less loyalty, right? And so while the awareness is important, they're not always just going to choose us just because. So that legacy of the service line would be important, and we would leverage like the different doctors that we have or the reputations that we have there as well. I hope that that answers it. I think that that was kind of multifaceted question.
I think that's good. Another question here. How can we balance operational overload and net new patient acquisition?
That's a good one. Erica, do you want to jump in on that?
Yeah, so this was something that we needed to address before anything launched. Like we needed to know that these service lines, that these providers had capacity for new patients. And that if we were going to increase capacity, could they also get more time in clinic? Could they open their schedules? Could they get more OR time? Like those were questions we asked beforehand. So we haven't run into having too many patients and having that concern. And if we do see an increase here, we go back to the original conversation of like, remember, we had the conversation that we would open up schedules. How do we make that work? And so that's worked for us. However, if something were to ever happen and the campaign was going to be affected and maybe patients weren't going to get in, or there was a provider leaving, you can always pause, turn this off, or reevaluate. But in terms of getting new patients, make sure that you have the capacity before you start this process.
Okay, and also, how do you determine when to pivot your strategy?
Yes, good question. Anne, do you want to take this one?
Yes, absolutely. Really, truly, it's all about the most important primary goal that you have, right? When we're thinking about this type of marketing efforts, you're always wanting to ensure that the financial investment that you're making is delivering on the results. So there's a lot of different ways to pivot in these types of approaches. Sometimes it's looking at your data sources. Sometimes it's looking at your audience strategy. It's channel mix. There's a lot of optimizations to make along the way. And really, truly, it's all about on a very frequent basis, looking at what you're defining as success and really driving those results. And if you're seeing that you may not be getting the return on the investment that you're hoping to achieve, it's definitely a good indicator that it's time to pivot in some way.
Okay, thank you. And then another question that's come in from a couple of people. Do you have a source that you use for the lists and or consumer data? Not sure about.
I think we got the question. Anne, do you want to speak to the data piece?
Yeah, oftentimes these types of strategies are really utilizing lists that are available for public consumption. And when we mean public consumption, there's a lot of third-party vendors that sell databases of consumers at a very broad population. So, we're not going to throw out loud names, but if you just do some Google searching, there's some really big players, and oftentimes these are the big data warehouses that exist. There's probably 5 of the top partners, and oftentimes it's really about getting access to those types of data sets.
Okay, thanks, Anne. And can you talk at all about ROI and how you might track the ROI on this and how far down the road from launching the campaign you might start looking at that?
Yeah, Anne, do you want to speak to that one as well?
Yeah, sure. And Erica, feel free to chime in
Yeah.
here too, because I know that this, oftentimes we look at when it comes to tracking ROI, it's all about being able to take who you've exposed to your marketing through those lists and really doing a match back to your patient encounter data. What we have found is that every service line really demands sometimes a customized approach on what that frequency might look like. We have certain service lines where we know that it may just take some time to see that return on the investment if there's a longer patient journey, as an example. And then there's certain, service lines such as ER or primary care where we know that there's just more frequent usage and encounters. And so again, it's all about really going towards what strategy you're trying to deploy. Anything else you'd want to add there, Erica, that I may have missed?
Yeah, for us, we're sharing this quarterly, and we always say the first quarter, especially with our specialty services, like we're not expecting to see this huge volume, right? This is a long-term play in marketing. We're not expecting immediate, but by the first half of the year, we do see a significant uptick, and we're sharing that with our executives quarterly. So yeah, Anne, I think you're right there.
Okay, speaking of sharing results quarterly or sharing the results with the C-suite, is there a format or cadence you would recommend? Well, I guess the cadence you mentioned would be quarterly, but is there a format that you share the results with your C-suite?
Yeah, so we hold quarterly meetings, and this meeting, sometimes it's just executives, but there's also times that lead managers are there, or people that like touch this campaign in a real way because we want them to see it as well. And then between those quarterly share outs, what we do is send out to that same group, we send these emails that talk about media metrics, things that we think might be valuable to hold engagement. Because for us, we're in it every day. But for this group, only seeing it quarterly doesn't always hold that engagement. So we're always looking for ways to communicate between those milestones.
Okay, so I think we have time for one more question here. And this is something that we always think is very important, is buy-in. How do you gain internal buy-in across all departments?
Oh, Erica, that's a great one for you.
Yeah, so this was really meeting with everybody before launching campaigns. sharing what precision marketing was, because a lot of people hadn't heard this term before. So really getting down to the basics there. Also, we found people wanted to know, what does this look like for patients? So we just had these sessions where we went through every question. And this is not just with executives. Again, this is our lead managers. These are the people in finance that are going to help us with some of this data. Anybody that we thought this could impact or could support, or we could support to make this go well, we looped them in before we launched these campaigns.
Okay, great. I think we've come to the end of our time here, so I really appreciate all of you, Erica, Trish, Ann, and Joss, for that terrific presentation. I'm sure the audience will join me in thanking you. And to everyone in our audience, thank you as well for taking the time to join us today. Please note that if you asked a question that we weren't able to get to, we'll do our best to get a response to you. And we'll also be sending out a link to the webinar recording. Watch for that within the next few days. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, and you can find details on the forum website, www.healthcarestrategy.com. And also, if you're interested in speaking at the 30th Annual Healthcare Marketing and Physician Strategy Summit, which is in Orlando, April 30th to May 2nd of 2025, the call for speakers is now open. You can find that on the forum website as well. That concludes today's program. Thank you and have a great day.